guys, welcome back to Medical Coding with Blue. Today's episode is all about the jobs you should avoid as a brand new certified medical coder. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, first things first, little disclaimer first. I will start off by saying this. Everybody's journey into medical coding is going to be different. And because of this, my advice may not fit for all of you, okay? But my advice comes from experience. It comes from being in the industry. It comes from knowing what the different positions that I'm going to talk about today actually do. And it's about you maximizing the time before you get into a medical coding position. Because sometimes it's a little difficult, depending on where you are in the US, to start in a medical coding position. So sometimes people will work in alternative positions, and these are the ones to avoid only because these positions do not require any medical coding knowledge. And you want to work in a position that's going to at least flex your knowledge about medical coding just a little bit, so that way you have some transferable skills. Now, yes, these jobs will get you into the hospital, but keep in mind that you may get stuck in these positions, especially if you're really good at them, okay? So that's just something that you have to know. You have to be strategic when you're out there trying to find your first job in medical coding. And again, there's nothing wrong with taking alternative jobs, and I've talked about the alternative jobs before. I'll probably leave the link for my video in the description box below that I did about it. You can also look it up. But try to go down those alternative roads too if you're having problems finding your first job in medical coding, okay? So without further ado, here we go. All right, so the first job that you should avoid as a certified medical coder just trying to get in someplace is a receptionist. Now, a receptionist is basically a greeter, and they let people know, hey, the patient is here, and they do a lot of things administratively around in the front area, typically. And that's what a receptionist does. And while it is very much needed, it is a very key part of the whole healthcare experience, right? Because that's the first person that you see when you're going into the doctor's office is the receptionist. And they're the ones that are taking those calls. And you know, if you've ever been on the phone before, you know those receptionists, they do a lot of work, okay? So, but that's not a position that you want to start in as a certified medical coder, because that's not going to flex your skill at all, okay? And you want to be able to use some of your skill and as whatever that you're going to do, like alternative job wise, but certainly it's not going to be in a receptionist position. However, if you are getting hired like at a smaller place and they say, oh, well, you know coding. Oh, well, that's cool. Hey, could you look at this for us? And yes, while there's some people who will be happy to do that because they're in a place, keep in mind they're paying you a receptionist rate. They're not paying you a medical coder rate. So there's a huge difference in the salary too that you got to think about. And you don't want to be taken advantage of simply because you just wanted to get into any kind of position, so you went ahead and got into reception. All right, the time that you're going to spend there, while you may make connections, it's not going to be filler for your resume. Okay, so that's just another thing that you got to know. All right, just my advice anyway. The next position is, of course, a secretary. Now, I talked about a medical secretary a few videos ago when I talked about test driving the medical coding industry to see if even if you wanted to do it, right? And I said that you could apply for a medical secretary position. I gave that advice to people who are not certified, because if you're not certified and you are wanting to see how these things go, and the medical secretary at that place is actually like circling from a super bill, the codes and things like that, that's helping that person to know if this is what they want to get into, because that's not actually coding. What that is just circling from, this is a list of our typical procedures and diagnoses codes that we use, and this is what we're going to have on the record for right now until the coder looks at it, and then the coder goes through and corrects or updates the codes. That's fine. But that's for somebody who's not certified and not somebody who's had formal training either, okay? Would it be ideal? Yes. But in this position, as a medical secretary, you have to also keep in mind that really good secretaries are often like kept into that one position because they don't want to let them go. Once they find somebody that they really like in that position, that the patients love them, they get along with the doctors, they get along with the nurses, and you're just, all around good person, they're not going to want you to get out of that position. And even though they say, oh yes, you should be able to do lateral transfers to other positions within the organization, sometimes that's not always the case, guys. And you have to be prepared for that. Don't be shocked when there's a little bit of sabotage that they don't want you to go anywhere else. And they may put more money in front of you and say, oh yeah, we'll raise your salary and that kind of thing. But again, that's not what you wanted to get into this industry for, to be a secretary. You wanted to get in to be a medical coder. So again, I would avoid medical secretary because it's very easy to be taken advantage of in that kind of position because of so many hats that the medical secretaries do. And again, this is a very important position. However, with somebody who has technical training like medical coding, you need to be looking for those positions that are going to help you to expand and build your skill. I'm just saying. The other one is referral coordinator. Now, a lot of people will see referral coordinator and, hey, this is just a great way just to get in. A referral coordinator spends a lot of time on the phone. It is a lot of telephone work. And if you've ever worked in a telemarketing agency, hello, like me, it is not a good time. You have people who have all kinds of attitudes, and you really develop a distaste for this, okay? And it's very easy to develop a distaste for being on the phone and being in this industry, period, if you are starting off in referral as a referral coordinator. Referral coordinators are, again, very much needed. They are very important. But for a person who is technically trained in medical coding, it's not a place where you're going to be able to build any sort of transferable skill. The only thing that you're going to have access to is the electronic medical record. And that's it. But you're not using it in a way that is familiar for coders. It's going to be based on, whatever they need to do in order to get these referrals going. Okay. So that's another one that I would avoid. The other one is patient access. Now, patient access means different tasks at different places. But from what I know of patient access, it's basically bringing the patient into the facility, like they're basically there at the front desk and they check you in. They get you to fill out any of the paperwork that they need you to fill out, and then they take you back to wherever you need to go, whatever department, whether it's radiology, MRI, or any of those things. And they take you back there. Basically, they escort you back there. Then they go back up to the front and they help with the other people. So that's essentially what patient access does. Again, the tasks may vary depending on where you are. But from what I know of patient access, again, there's nothing involving coding. There's nothing involving using your skill. And again, it's about making sure that you're making good use of the time that you are starting in the industry. You want to make every job count. Every position that you hold, every hand that you shake, you want it all to count because, again, time is very precious. And for those of you who have the CCPCS, and you know how it's very important that you work, your 2 years, if you have to fulfill the 2-year time commitment. Some of you have to only fulfill 1 year because you've done Practicode or whatever the case may be. But for whatever the case may be, you still need to have your amount of time in order for you to get that apprentice status taken off. So it's very important to make very good use of your time in the beginning, from the beginning, to be able to get where you want to go efficiently and quickly. All right? Because again, time is very precious and time will go just like that. And by the time you know it, hey, I started off as a referral coordinator 5 years ago and I'm still doing that, but I really wanted to do medical billing and coding. I just could never find a job. You started in a place where it's not going to flex your skill, and a lot of you stop studying, which I really would hope that my videos can get you to understand the importance of studying even after you've gotten your certification. Because the problem that happens after you get certified is that some people are saying, oh, thank goodness, Now I don't have to study anymore because I have my certification. But when you're out there applying for jobs, they are going to test your skills. They have to, and because everybody learns differently. Not everybody goes to the same school, and some people will learn independently. Some people will learn through, a fast-paced medical coding program. Some will go to a college, So again, there's just a variety of ways that people get into the industry. So they have to test you, and they have to know your level of ability. So even veteran coders, I've seen veteran coders get very upset about this on LinkedIn. They said, I've been in the industry, I have all these years of experience. Why should I have to spend, 3 or 4 hours doing a test? Because they need to know what you know. Because even veteran coders who have years of experience can find themselves locked into one particular specialty and they don't do anything else, right? So a lot of that stuff comes mundane. It's just the same old all the time. And then when they try to go someplace else, they can't code anything else but what they're used to. And again, there's no need for that. If you had years of experience, you should, in theory, be able to go anywhere and be there for maybe a couple of weeks to get yourself acclimated to that particular clinic, and you should be able to pick it up with ease. Because we are all tested on the same set of codes. And because of this, we're tested on all the chapters, all the specialties. So this says that if we have a certification, it says that we have the competence to be able to code in any specialty. Okay, so that's something that you have to understand, that when you get your certification, yes, take time to celebrate, but don't stop studying. And you don't have to be as intensive as you were before you were trying to pass your test. But you do have to take the time, at least every week, to go through a workbook and work through the work problems and things like that. That's very important. Reading through the guidelines is still important, but it can take a back seat to your through working through the workbook. Because any of the workbooks that I have recommended, the ICD-10-CM and ICD-10-PCS coding handbook with the answers, you can get the 2020 version and up, okay? But if you get the current year book, keep in mind it's got the same questions as the last year book, and the last year's book is cheaper. Okay, I'm just saying. And then, of course, the CPC study guide. Now, yes, even though you may have an AHIMA credential, I still recommend the CPC study guide. And again, 2020 and up. The CPC study guide, because AAPC actually got it right. They did a fantastic job with that book. And I will always recommend materials that are going to be helpful to medical coders. And it doesn't matter who the organization or person who puts it out. If it's good, I will let y'all know. But yes, the links for those books, again, are in the description box below. You don't have to get those particular year books. You can always get newer books if you want to. It's totally your choice. Some of the newer year books will actually probably be cheaper than the ones that I have been recommending, because I have seen the price go up on those books, and that is startling. So, but at least this way you know which books I'm talking about, okay? There's many publishers out there, but those two, the one by the American Hospital Association and the one by AAPC, the one I just said, those are really fantastic to continue to work through, because it will give you really good practice. Okay, so practice. And the final job to avoid as a brand new medical coder is a scheduler. Again, it's going to be a lot of phone work, and it's going to be a lot of dealing with patients and providers and things like that. And just the different specialties and things. So you have to make sure that you keep in mind when you get into a position like this, there's nothing that's going to transfer over that's coding wise. Okay, there's no reviewing of codes. There's no applying codes, any of those things. You are literally scheduling a patient's appointment. And yes, while you may know what the appointment is for, right? Because, ooh, I'm going to sneeze. Because you have to put that in the system. It's not about coding. And so again, you want to spend time with jobs that are going to give you that filler for your resume. The filler that says, hey, yes, I did, have some exposure to medical codes. I did have exposure to procedures and, seeing how it all goes into place, whether it is in one of the other alternative positions, But again, these positions are for people that are maybe not interested in coding, okay? And there's people out there that are like that. They say, well, no, Blue, I could never be a coder. That's just too hard. It's not too hard, guys. Once you get into it, it's actually quite enjoyable. At least I enjoy it. And I think that I bring that energy when I come here with all of you about it, because I love it. I've given 15 years of my life to this industry. Okay, 15. So, and I wouldn't change anything. I really wouldn't change anything. This has given me the best gift of my life, to have a career that I love, because it doesn't feel like a job to me. It's a career. And, if you love what you do, you never work a day in your life. And I'm there. Thankfully, I am there. I have been there since 2014 when I had my aha moment. Like, now I get it, And people sometimes wait their whole life for this feeling. And some people never get this feeling. And I feel bad for those people because, what did you want to do in your life? What did you think that you wanted to do so badly that you just never achieved it, right? This gives me something to look forward to every day, whether it is at work or on my Patreon channel or here on YouTube with all of you. It gives me something to look forward to, and I'm so thankful for that. But this is my advice anyway, guys. So I'm just hoping that you all avoid the pitfalls that a lot of new medical coders fall into, like getting these jobs that are not really in tune with medical coding, so I'm hoping that y'all can avoid those so that you can spend more time in positions that will help you, like billing, like prior authorizations, and even in a temporary sense, risk adjustment. And I say a temporary sense in risk adjustment because with risk adjustment, it is just diagnosis coding. And I have seen personally some of these job listings, it's been more than one, okay? More than one job listing that has said that if your only experience is in risk adjustment, that they do not count that. And because it is only diagnosis coding, there is no procedures, there is no modifier application, there is no E&M leveling. So you have to be very careful, because a lot of times some people will just get so involved in the diagnosis coding that they forget how to do procedure coding. And that is the one that will unlock a lot of opportunity for you, okay? But you have to be able to meet that challenge and meet the challenge head on. This is not something to run from or be scared of. If you don't understand, find a mentor, find a tutor, somebody who can help you to understand it. A mentor is free, a tutor you're gonna have to pay for. Sometimes you have to put out a few extra bucks, but you know what? It's worth it, especially if it helps you to, oh, now I get it. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.